Are you ready?
Yeah, there you go.
Oh my gosh, hurry up. I put this in so I could take a deep breath because I knew he was talking about every 15 seconds. So I want to thank the organizers for inviting me to this stressful event. And I hope you can learn one thing in 5 minutes because that's all I planned. All right, this is how I got started in innovative surveillance, or if you're a sports fan, Linovative surveillance. Sorry, couldn't help it. I was then the study director for this report, of which one of the recommendations about innovative surveillance was more research. So here I was 5 years later at Google, where we did some innovative research, we hope, and looking at to see whether people searched on the internet before they actually went to their healthcare providers, and we found about a 2-week advance notice for flu. This is a slide that I borrowed from John. I see he had one today that was much more up to date and cool, but it basically shows all the different kinds of sources of information out there, of which we looked at search, but there's lots of other people looking at all these other sources. Of course, this is not as cool as the slide that you just saw about networks, but this was something I looked at that I called the pandemic paradox, because the same networks that we're using to spread the disease should be the same networks that we find out more about this disease. And this is making it easier when we have mobile phones around the world that we can even be doing this in very remote areas. And we're really excited about this kind of technology and looking to see whether we could do more advanced surveillance. So I also had the pleasure of working with Anne-Marie Kimball this summer at Singularity University, where students from around the world, major overachievers, are looking at trying to develop a project that will impact 1 billion people within 10 years. And they were looking at things that had to do with disease surveillance, and this is going really fast. At the same time, our sister organization launched a movie called Contagion, and so we were trying to figure out, is there a way to sort of take this energy around people looking at innovative ways of surveillance and give people something to do? So part of the movie, we launched Take Part, which is a social action campaign, and we involved Health Map as what we thought was a really good vehicle to show people that pandemics actually are happening around the world, or at least engaging them in thinking about the global perspective. So John and I worked together to think, what could we do as a project, which our code name was the Contagion Project, and we were basically thinking, could we get people to go viral to help? And so our idea was to really partner with the leading public health organization in the United States, the American Public Health Association, with its 50,000 members, to see whether we could have the largest community of sentinels in an open, voluntary online surveillance system. And we challenged them by asking them if they had that in them. Obviously, it wasn't a completely new idea. There's been 2 large-scale efforts around this, one with 10 countries in Europe, and another with a former colleague of mine when I was on the hantavirus team, doing it in Australia. So we used all the information that we could about those 2 systems, and we launched Flu Near You with Health Map and the American Public Health Association with funding from our foundation. So it's a really simple system. You get an email reminder every week. You click on the link, and this is what you get. And we were basically wanted it to be simple and quick, something that would not take more than 5 to 10 seconds. If you have no symptoms at all, you can just click that box, and then we hound you if you haven't got a vaccine every week to ask you whether you got the vaccine. Once you answer the question yes, then you don't see that one anymore. If you do click one of the symptoms, then we've designed it where if you click fever, we're actually trying to ask what the temperature range was, as well as to give a reminder about when did your symptoms actually occur, so we could start to do some back-end analysis of whether people had influenza-like illness, and also be able to be compatible with the other systems that were using different measures for the actual temperature. And then once you submit, you see yourself on the map, and along with the other information for the location from which you submitted this. So obviously I live in San Francisco, so this is the information for California. Obviously, our longer-term plans are to try to put point-of-care diagnostics alongside such a self-reported system, as well as to take it into other diseases. For example, we're looking at dengue right now as a possible next one. Our foundation's bigger perspective is to take this to parts of the world where we're worried about pandemics arising and seeing whether we can do open surveillance in communities in what we call the hotspots for emerging infectious disease. And that's the end of my 5 minutes. And I hope you'll check out Flu Near You and have it in you to participate in this pilot system. Thanks.